Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hello, everyone. Welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. And today we're going to be talking about the sensory being. Now, as we've talked about in the last several podcasts, this is part of the series of what I like to call the Seven Remedies of Being. And these are all the things that we need to help us get closer to being a human being and stop being human machines. And so as we talk about this, again, we're trying to get back to feeling and just being kind to ourselves and taking care of ourselves. So just to review, the seven remedies are our physical being, which is our health, our mental being, which is our mental health, our spiritual being, which talks about really what is our own spirituality and how do we connect with something greater than us. Today, we're going to talk about the fourth remedy, which is the sensory being. And that really is going beyond what we actually can touch and feel and see. These four are really about how we connect to ourselves. Now, the next three are going beyond that. The next two are our relational being, which connects with how we connect to other people. And then the sixth one is our community being. And this really is how we connect to each other here in this community, in healthcare, how we connect in our social communities. And then finally, the last one is our intentional being. And that's a much broader conversation, which is really how do we move in this world and what is our true internal purpose? What are we trying to get to? What's going to make us truly happy? So like I said, today, we're going to go ahead and talk about our sensory being. Now, I have to tell you, I love Gary Zukav's Seat of the Soul because I think that he really defined this very nicely, that makes it very easy to understand. And when we think about our senses, we think about the traditional things, which are our sight, our taste, our smell, our hearing, our touch. And really, all of these are how we move throughout the world. And if for some reason we lose one of these senses, it goes away, but then some of the other senses will take over and they get almost like a super intense version of that. But what happens when all you can do is interact with what you can actually see and hear and feel? What about everything else? And so what ends up happening is the physical world becomes your limit. And we can only really react to what is put in our lap in that moment. And it doesn't allow us to go beyond that. And so what Zukav talks about in Seat of the Soul is it's the multisensory being. And this really takes into context all of these senses, but it also expands it into an awareness of the non-physical reality that exists. And so, in medicine, we're scientists, right? And so we love to measure things and we love to keep track of things. And we need to know, is it going higher or lower? Is it getting worse? Is it getting better? And many of these things are the physical world where we can do these calculations and do these measurements so that we can work very precisely. And there's not a whole lot of room for error because you have to have all of these in order to make these diagnoses and to treat these patients and to really progress in a scientific way. The problem that happens with that, if we're in only a five sensory approach, is it, like we talked about in the last podcast, we move into a place of what's called external power. And so the problem is that now, because we know all these things, we begin to try and control all of our needs based on fear fear of being incorrect, fear of missing the diagnosis, fear of hurting someone, fear of being wrong. So that style is what he calls the intellectual. And I think there's a much broader version when he talks about the multisensory being. And I think that this is really key because I think in medicine, when we're really good at doing what we're doing, we're expanding beyond just the measurements because sometimes we're making decisions with very little information. We don't have that information, or they've come and it's happening so fast, we don't have time to gather information. And so the things that are beyond our physical world are things like our intuition. What's happening? I just feel like this is going, I've seen this before. It has such a feeling like this or that. You've learned, you've incorporated all of these experiences. You don't have the data to back up what you think, but based on how it's presenting, you have a feeling, you have an internal knowing of what you believe is going on. And then you're able to move in that direction. And, this can be something about treating a patient. It could be, you know, we have all had when people come to us and they're losing their mind and they're just sobbing and so upset. And it's not quite what they thought it was going to be. That they're telling you one thing, but there's something much further beyond that that is involved here. And so this is using our intuition. The other thing is insight. And insight is, force, but it's also being able to take a step back and look at everything, insight into our own actions, insight to what was happening, what may have happened. And you're trying to piece together these things that you don't have hard data to be able to assess. And also it allows you to really have a self-critique of who you are and how you did something, and is this the best way, and can we do something different, not out of a criticism, but simply out of improving what we're doing. This also gives us purpose. And why are we doing these things? I mean, purpose drives us all the time, and people's purpose influences their behavior all the time. And it's not something that you can necessarily touch or smell or see. So we have to think about it in a much broader sense. The other things are meaning and clarity. And it's hard to be, sometimes you don't have all this concise information to have a clear picture, and you're trying to get meanings and you're trying to get clarity, but it's not necessarily available. And I like to think of this, when we talk about, well, what exactly is a non-physical reality? Well, in medicine, we have a ton of these things, right? And, one of the most basic things that we have, infection. We know something's going on. And when you look at the blood or the urine or whatever bodily fluid, you see fluid and you don't see anything. It doesn't look like anything is there. But when you go beyond and you expand your mind and say, look, we've got to look a little bit deeper. I think there's more to this than what I'm seeing. And we put this under a microscope, right? This is going to expose our view so much bigger. And so now we can say, oh, look, here's the bacteria. Oh, here's the fungus. This is what our problem is. Well, and then you can take it further. Well, now we've used these modalities and these treatments and this antibiotic. Look, it's growing. And so this is not going to work, but this one, it's not growing. So it's totally going to, this is our answer right here. But none of that could you see that, number one, when you saw the patient, and number two, you couldn't see it in the fluid, but it's all there. Another example is perhaps if you think about using a telescope, right? There's a lot of things we can't necessarily see just standing out on the street and looking up with our bare eyes. And then we look through a telescope and we magnify our view. And now we're going to get things that we were never seeing. And so we want to think about this with just kind of taking a step back and it's not just these little tiny things. And what you see is what you get. There's a lot more to it. I think that the other book that I really enjoyed, and I think I really try as best I can, because some of these are really hard to live by. Is called The Four Agreements, and this is by Don Miguel Ruiz. And honestly, I love to have my staff read this. When we get new staff, I like to have them read it, and then we have a discussion about this, because this really is core to how we are treating other people and who we are and who they are, and expanding beyond perhaps what you can actually see in that moment. So the four agreements are, um, be impeccable with your word, don't take anything personal, don't make assumptions, and always do your best. And so the first one is be impeccable with your word. And this is really, I see this as just don't gossip, speak with integrity, always tell the truth. And here's the thing, always say when you don't know what's going on, and don't say something and pass it on without necessarily knowing. And if you have a credible source, use your source and say, you know what? After speaking with so and so, it was brought to my attention about this, right? So you want to credit people, right? There's lots of people. You hear me crediting both of these authors. I can't do all the things of all the world. There's so many amazing people, and they deserve the credit. So credit them, tell people about it. But really, when you're telling a story, it's interesting when we present on rounds just the facts, right? Just tell us what happened, not what you think happened. Just tell us what you know, which that way we can begin to formulate a picture of what's going on, and not like, well, this guy, he did this, or he was in this condition, and so he probably did that. Those are the things that really get us into trouble. We just have to come back, be impeccable with your word, speak what you know. Don't speak what you don't know. Credit the people who give you information so that that information is sourced properly, and don't gossip. Now, the second one, don't take anything personal. I feel like that is really difficult because, sometimes it really does feel personal, and it feels like people are out to get us. And, it's really, really difficult. But sometimes you just have to recognize that others' actions and what they're doing, it's a reflection of what's going on with themselves. It has nothing to do with you. And in many times, I mean, we've seen this time and time again where, you're just, you're talking to somebody and they are saying one thing, but this has nothing to do with that. There's something more behind that. And you may not know exactly what that is. You can get to it. You've got to give them some time and give them some grace and some space. And keep safety in mind, right? So don't sit there and be the punching bag, whether it's physically or emotionally for someone. Get yourself out of those spaces and get to a safe space. But realize that sometimes people are responding and they're treating you poorly, but it has nothing to do with you. It has to do with maybe their anger and their fears over things that you have no control over, and things that may have occurred before you even showed up on scene with whatever was going on. So it really is very difficult, because there's so many things that are just like, you're out to get me, and this is, a personal vendetta. And in many cases, there's something behind that. And so just keep that in mind. The third one is don't make assumptions. And again, this is really difficult. And I think that, we're always trying to put together a story. We've got to have a story to tell that's associated with an occurrence that we had, a feeling that we had, whatever. And so there's a whole story that has to be made. And the problem is that there's always gaps in that story. And so we have a tendency to fill in the gaps with what we think is most probable. And it's tainted and colored by our own personal feelings about that. And what is the person? What have they done in the past? What's going on? Things we've heard, what's going on globally. You know, this is where you get stereotypes, right? And you just automatically assume things that aren't even necessarily true. So the thing is that you need to ask questions. This is, If you want information, you don't make up the story. You ask questions, you seek information to be able to piece together, you know, what is the truth? Because as you go on, the more assumptions that you make, the story gets muttered. It's muddled. It's you just lose all the content, and the essence of it is dissolving right in front of you. And so what ends up happening is you're progressing into conflict, right? It's taking you right to conflict because you're moving on information that is simply not true. It's made up. And so sometimes you might get lucky because there's a pattern of someone's behavior and that is the case. But here's the thing, you're never ever going to be pleasantly surprised. You're going to be disappointed that you weren't right when something turns out better than you expected. And that's just kind of a hard way to live. Like we want to be excited for someone, and maybe we're worried that someone's intentions or someone is doing something for a certain reason, but then when we ask questions, we get information, we realize actually this is not the case at all, and the intentions were different, the outcome was different, and in fact we are pleasantly surprised by that. So I think this is really a big one, and I think this is one of the things I think that most people struggle with on a daily basis. And the last one is do your best. And I have to remember that you don't show up for yourself the exact same way every single day. And the thing is that our sense of who we are translates so many times of like what the outcomes are. And we have to go beyond that, right? This is the bigger picture. We have to go and understand that we are not perfect and we're going to show up differently every day. But here's the thing, if we show up giving our best every single day, we couldn't have done it any better. It just makes it so that self-acceptance is it's right there, right? We don't have to chase it. We understand us. We've done the best that we could. We're okay with that. And that may not have been enough, but you know what? There was no more to give. You simply gave everything you had in the best quality that you could. And that's okay. And it's just fabulous. Like there's nothing more possible at that point. So the other thing is that it also helps kind of take away and give you freedom from regret. Because if you're sitting there and you've not done your best, then it becomes the, gosh, well, I should have, I could have, I would have. And so then you go down this whole other path that, maybe you did a great job, but it wasn't up to what you thought was your best. And so you begin to take that apart and really dissect it out and criticize, and there may be a good outcome and you still can't accept that and you're just regretful about that. And so I think this really goes back to the whole concept of perfection. And again, we need to let go of perfection because we are not perfect. We are human beings, not machines. And so we're going to make mistakes. And if we're doing our best, then we can navigate this really authentically, but realizing that perfection is excellence without the ability to pivot or breathe. And so when things change, when it's unexpected, we need to dig deep into the well of knowledge of what we know, and we need to shift and we need to be flexible so that we can get to that, whatever that is, and be okay with that. So I want to be really, really mindful about perfection because that is our Achilles, and we've got to begin to unravel that. We're looking for excellence, not perfection. We are human beings, not doing machines, which is what excellence will give us. Perfection, it's just not real, and we just can't get to it. So I just want to say thank you for this. This will be a short podcast this time. I'm digging deeper into this. I'm certainly not an expert. I'm not a guru. I'm just here to be a guide to give you some things to think about. These are two great books. Again, Seed of the Soul by Gary Zukav and The Four Agreements by Don Miguel Ruiz. Check those out. They're available online. And I believe both of them actually have websites, so you can check that out. I know that Ruiz has even YouTube discussions reviewing the book as well. So that would be a great place to go in and get a quick review even before the book arrives. But check those out because I think those will be helpful. And, just remember that, we're talking about our well-being here, and we're trying to show up better for ourselves. And when we show up better for ourselves, we're going to show up better for other folks. And so we've got to really work on being the best version of ourselves for us long term. And just remember that the deepest embrace that you'll ever have is the complete embrace of your own humanity, exactly how it is. Thanks so much. See you next time. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.